Welcome to this deep dive into the world of fibroadenomas.
Yeah.
We're tackling this topic because it's something you're interested in learning more about.
Yeah.
So we've gathered up all the latest research and medical insights to give you a clear picture of what fibroadenomas are all about.
That's right. Whether you're getting ready for a doctor's appointment or just received a diagnosis or are just curious.
Right.
We're going to unpack the essentials about these benign breast tumors, including why they occur, what they feel like, and the different treatment options available.
Perfect. So let's just dive right in. First things first.
Sure.
What exactly is a fibroadenoma?
Well, in the simplest terms, a fibroadenoma is a solid, non-cancerous breast lump made up of glandular and connective tissue.
Okay.
They're often described as feeling firm, rubbery, and mobile. Almost like a little marble that moves around under the skin.
Okay.
In fact, there's even a nickname for them, breast mice.
Oh.
Because of how they can scoot around.
Breast mice. I love that.
Yeah.
It's like a vivid image.
It is.
And it definitely makes it easier to remember.
Yeah.
But why do these breast mice appear?
Yeah.
Especially in younger women.
Well, while the exact cause is still being researched, we know that hormones, particularly estrogen, play a significant role.
Okay.
Think about it. Fibroadenomas are most common during those times in life when estrogen levels are naturally fluctuating, like puberty, pregnancy, and even during certain types of hormone therapy.
So it's all about those hormonal shifts.
Exactly. And there's another fascinating link that research is uncovering. Diet. Some studies suggest that a diet high in fat might actually stimulate the growth of fibroadenomas.
Wait, really?
Yeah.
So what we eat could directly impact the development of these tumors.
That's what the research is suggesting.
Wow.
It highlights how interconnected our bodies are and how lifestyle choices can influence our health in unexpected ways.
That's definitely food for thought. Now, if someone were to discover a lump, how would they know if it's likely a fibroadenoma?
Well, there are a few key characteristics that can help distinguish fibroadenomas from other types of breast lumps.
Right.
As we mentioned earlier, they tend to be firm, rubbery, and easily movable under the skin.
Right.
They're usually painless.
Okay.
But some women might experience mild tenderness, especially right before their period.
So it's that combination of firmness, mobility, and generally painless nature that points to a fibroadenoma.
Exactly.
Okay.
But it's crucial to remember that self-diagnosis is never a substitute for professional medical evaluation.
Right.
If you notice any new lumps or changes in your breasts, the best course of action is to schedule an appointment with your doctor right away.
That makes perfect sense.
Yeah.
Early detection is key for any breast health concern.
Yes.
So let's walk through the diagnosis process. What can someone expect when they go to the doctor with a suspicious lump?
Well, the first step will typically involve a physical exam, where the doctor will carefully feel the breast tissue, assessing the size, shape, consistency, and mobility of any lumps. Based on their initial findings, they'll likely order imaging tests.
And those imaging tests would include things like ultrasounds and mammograms, right?
Exactly. Ultrasound is often the preferred initial imaging test for younger women because it's highly effective at distinguishing solid masses like fibroadenomas from fluid-filled cysts.
Okay.
Mammograms, which use X-rays,
Yeah.
might also be recommended, especially for women over 30.
So these imaging tests help paint a clearer picture of what's going on inside the breast tissue.
Precisely. They provide valuable information about the lump's characteristics, which helps guide the next steps in the diagnostic process.
Okay.
In some cases, a biopsy might be recommended.
A biopsy, that's where they actually take a small sample of the tissue to examine it under a microscope, right?
Exactly. A biopsy is the gold standard for confirming a diagnosis and ruling out any potential malignancy. It allows pathologists to analyze the cells and determine the exact nature of the lump.
So it's that biopsy that gives the definitive answer about whether it's a fibroadenoma or something else.
Precisely. While imaging tests provide valuable clues, the biopsy provides the most accurate and conclusive diagnosis.
Right.
And it's the reassurance most people are seeking when faced with a breast lump.
Absolutely. It's all about getting that peace of mind.
Yes.
And knowing exactly what you're dealing with.
Right.
Now, once fibroadenoma diagnosis is confirmed, what happens next? What are the treatment options?
Well, that's where things get really interesting.
Okay.
And it's an area where we've seen significant advancements in recent years. But before we jump into the treatment options, I think it's important to first understand the different types of fibroadenomas.
Okay, let's unpack that.
Yeah.
You mentioned that there are different types of these breast mice.
That's right. The most common type is called a simple fibroadenoma. Picture a smooth grape. That's what a simple fibroadenoma often looks like under a microscope.
Okay.
Then you have complex fibroadenomas, which are a bit more, well, complex. Think of a raisin. It's still a grape, but it's wrinkled and has more intricate features.
Right.
That's kind of like a complex fibroadenoma. It has additional components like cysts or calcifications within the tumor.
So a simple fibroadenoma is like a smooth grape, and a complex one is like a wrinkly raisin.
Exactly.
I love those visual analogies. It definitely helps to understand the difference.
Good.
But do these different types impact treatment decisions?
Absolutely. The type of fibroadenoma, along with its size, growth rate, and any associated symptoms, will all factor into determining the most appropriate course of action.
So it's not a one-size-fits-all approach?
Not at all.
Okay.
Each case is unique.
Yeah.
And the treatment plan will be tailored to the individual's specific needs and circumstances.
That makes sense.
Yeah.
So let's talk about those treatment options. What are the different paths someone might take after being diagnosed with a fibroadenoma?
Well, one of the most common approaches, especially for smaller, slow-growing fibroadenomas, is watchful waiting.
Watchful waiting. So basically just keeping an eye on it.
Precisely.
Okay.
It involves regular monitoring with ultrasounds or mammograms to track any changes in size or characteristics.
Right.
If the fibroadenoma remains stable and isn't causing any discomfort, active intervention might not be necessary.
So it's a wait-and-see approach, but with careful monitoring to ensure things aren't changing.
Exactly. And this is often the preferred route for many women, especially those who are asymptomatic.
Yeah.
But what if watchful waiting isn't the best fit either because the fibroadenoma is growing, causing discomfort or causing anxiety? That's where the array of treatment options comes into play.
Okay, let's explore those options. What are some of the ways fibroadenomas can be treated if monitoring isn't sufficient?
Well, one approach involves lifestyle modifications. Some studies suggest that reducing caffeine and dietary fat intake might help to slow down fibroadenoma growth.
Okay.
Additionally, certain herbal supplements like green tea extract and evening primrose oil have shown some promise in preliminary research.
So even simple tweaks to diet and lifestyle could potentially make a difference.
That's what the research is indicating. It's a reminder that our daily choices can have a profound impact on our health, even at the cellular level. And don't underestimate the power of stress management. Chronic stress can disrupt hormonal balance, which could potentially contribute to fibroadenoma growth. Techniques like yoga meditation and deep breathing exercises can be incredibly helpful in keeping stress levels in check.
It's amazing how interconnected our bodies are. Stress hormones, diet, they all play a role.
They do.
But what about medications? Is that ever used for fibroadenomas?
In some cases, yes. If a fibroadenoma seems to be particularly sensitive to estrogen, hormone therapy might be an option. And of course, over-the-counter pain relievers can help manage any discomfort or tenderness.
So there's a range of non-invasive approaches that can be explored.
Right.
But what about those situations where a more active intervention is needed?
Yeah.
What are the options then?
That's where we start venturing into the realm of minimally invasive procedures, which have really revolutionized fibroadenoma treatment in recent years. One of the most exciting advancements is cryoablation, also known as freezing therapy.
Cryoablation? That sounds intense. How does it work?
It's actually a very precise and elegant procedure. It involves inserting a thin probe into the fibroadenoma, which delivers extreme cold to the target tissue. The cold essentially freezes and destroys the fibroadenoma cells.
So it's like freezing the fibroadenoma away.
Exactly. And the beauty of cryoablation is that it's minimally invasive, meaning no incisions or sutures. It typically only requires local anesthesia and can often be performed in an outpatient setting.
That sounds incredible. Less invasive, less downtime. It seems like a game changer for fibroadenoma treatment.
It really is. And the benefits go beyond convenience. Cryoablation also tends to result in minimal scarring, which is particularly appealing for many women. I recall a patient who opted for cryoablation for a fibroadenoma that was causing her discomfort. She was back to her normal activities within a day or two and was thrilled with the outcome. She told me it felt like a miracle. The lump was simply gone.
Wow, that's a powerful testament to how far treatment options have come.
Yes.
Are there other minimally invasive techniques out there besides cryoablation?
Absolutely. Another option is radiofrequency ablation, or RFA, which uses heat instead of cold to destroy fibroadenoma tissue.
Got it.
A thin needle is inserted into the tumor, and radiofrequency energy is delivered, creating heat that ablates or destroys the targeted cells.
So it's like zapping the fibroadenoma away with heat.
That's a great way to put it. Like cryoablation, RFA is minimally invasive, requires minimal downtime, and typically results in minimal scarring.
These technological advancements are amazing. It's incredible how these procedures can target and eliminate fibroadenomas with such precision.
Yeah.
Are there any other cutting-edge techniques on the horizon?
There are. One that's particularly fascinating is high-intensity focused ultrasound, or HIFU.
Okay.
It's still under investigation for fibroadenoma treatment, but it holds immense promise.
Wow.
Imagine using focused ultrasound waves, kind of like a highly precise sonic scalpel, to target and destroy the fibroadenoma tissue from outside the body.
Wow. So no needles, no incisions, just sound waves eliminating the tumor.
Exactly.
That's incredible.
It sounds like science fiction,
Yeah.
but it's rapidly becoming a reality. Early studies have shown encouraging results, and researchers are optimistic about its potential to transform fibroadenoma treatment.
It's exciting to think about the possibilities. But let's not forget about traditional surgery.
Yeah.
Is that still an option for fibroadenomas?
Yes, surgery is still a viable option, especially for larger fibroadenomas, those that are growing rapidly or those that are causing significant symptoms.
So in some cases, surgery remains the best course of action.
Precisely. The most common surgical procedures for fibroadenoma removal are lumpectomy and enucleation.
Okay.
A lumpectomy involves removing the entire lump along with a margin of surrounding breast tissue, while an enucleation focuses on removing just the lump itself, preserving as much healthy breast tissue as possible.
What about mastectomy? That ever performed for fibroadenomas?
Mastectomy, which involves removing the entire breast, is extremely rare for fibroadenomas.
Okay.
It's typically only considered in very specific situations, such as when there are multiple large fibroadenomas or if there's a strong family history of breast cancer.
So it's reassuring to know that such a drastic measure is rarely necessary for fibroadenomas. Now let's talk about recovery.
Okay.
What can someone expect after undergoing treatment, whether it's watchful waiting, a minimally invasive procedure, or surgery?
Recovery varies depending on the chosen approach. With watchful waiting, there's typically no downtime or recovery period as no active intervention is taking place. Minimally invasive procedures like cryoablation and RFA usually involve minimal discomfort and a quick return to normal activities.
Got it.
Surgery, on the other hand, requires a bit more recovery time.
So with surgery, there would be some incision care, activity restrictions, and potentially some pain management.
Exactly. But even with surgery, most women recover fairly quickly and comfortably.
Okay.
Pain medication can help manage any discomfort, and your doctor will provide specific instructions on wound care and activity limitations. It's important to listen to your body and allow yourself adequate time to heal.
So it's all about following your doctor's guidance and prioritizing rest and recovery. Now, once someone has undergone treatment, what about long-term monitoring? Is that necessary for fibroadenomas?
Absolutely. Regardless of the treatment approach, long-term monitoring is crucial for overall breast health.
Okay.
This includes regular breast self-exams to familiarize yourself with the look and feel of your breasts and to detect any changes early on.
So it's about becoming your own breast health advocate.
Precisely. And it also involves regular checkups with your doctor, including clinical breast exams and mammograms or ultrasounds as recommended.
Those routine screenings are so important for catching any potential issues early on.
Yes.
Now, I know this is something that weighs heavily on many women's minds. The connection between fibroadenomas and breast cancer. Can you shed some light on that?
Of course. It's a common concern, and understandably so. But it's crucial to emphasize that fibroadenomas themselves are benign and do not increase your risk of developing breast cancer in the future.
That's reassuring to hear. But I think it's important to distinguish between the different types of fibroadenomas, as you mentioned earlier.
Right.
Don't complex fibroadenomas carry a slightly higher risk?
You're absolutely right.
Okay.
While simple fibroadenomas have no association with breast cancer risk, complex fibroadenomas, those with additional features like cysts or calcifications, might carry a slightly elevated risk.
So it's that wrinkly raisin type that warrants a bit more attention.
Exactly. But even with complex fibroadenomas, the overall risk increase is still quite small. It's important to discuss your individual risk factors with your doctor and follow their recommendations for monitoring and screening.
So knowledge awareness and open communication with your healthcare provider are key. Now let's address a couple of common questions that often come up regarding fibroadenomas. First up, can they go away on their own?
It's possible, especially for those that develop during a woman's reproductive years.
Okay.
Some fibroadenomas might shrink or even disappear after menopause when estrogen levels naturally decline.
So there's a chance they might simply vanish over time.
Exactly.
Okay.
But it's not something to rely on. Regular monitoring is still essential to ensure that any changes are detected early on.
Right.
And here's another common question. Is surgery always necessary?
Okay.
Not at all.
Good.
As we've discussed, many fibroadenomas can be safely managed with watchful waiting, and minimally invasive techniques offer excellent alternatives to surgery in many cases.
Right.
The best approach really depends on the individual situation.
Taking into account the size, growth rate symptoms, and the woman's personal preferences.
It's about finding that personalized approach that addresses both the physical and emotional aspects of the condition.
Precisely. It's a collaborative decision-making process between the woman and her healthcare provider, weighing the benefits and risks of each option, arriving at the best course of action for her unique circumstances.
It's all about empowering women with knowledge and options so they can make informed decisions about their breast health. Now, before we move on to our final part, I want to touch on something that we often overlook in medical discussions.
Okay.
The emotional and mental well-being of those dealing with fibroadenomas. Even though they are benign, the experience can still be emotionally challenging.
Right. It's so important to acknowledge the emotional impact of a fibroadenoma diagnosis.
Yeah.
Finding a lump, even if it's benign, can be scary and trigger a wave of anxiety.
Yeah, absolutely. It's just, you hear lump and you immediately think the worst.
Right.
So how can someone navigate those feelings and find support during this time? Well, first and foremost, don't bottle things up.
Yeah.
Talking about your experience can be incredibly helpful, whether it's with a trusted friend, family member, therapist,
Right.
or even an online support group.
Yeah.
Sharing your feelings and connecting with others who understand what you're going through can make a world of difference.
That sense of community and shared experience can be so powerful. It helps to know you're not alone in this.
Absolutely. And remember, knowledge is power.
Yeah.
The more you understand about fibroadenomas, the less scary they become. Don't hesitate to ask your doctor questions.
Right.
Seek second opinions if needed.
Yeah.
And do your own research from reputable sources.
It's about taking control of the situation and feeling empowered to make informed decisions about your health.
Exactly. And beyond talking and gathering information, there are other things you can do to manage stress and anxiety.
Okay.
Mindfulness practices like meditation or deep breathing exercises
Right.
can help calm your nervous system and bring a sense of peace. Gentle exercise, such as yoga or walking in nature, can also do wonders for both your physical and emotional well-being.
It's all about incorporating those self-care practices into your routine and making time for activities that nourish your mind and body.
Now let's shift gears a bit and zoom out to the bigger picture of breast health.
Oh.
Fibroadenomas are just one aspect of breast health, and it's important to be proactive in caring for your breasts overall.
So what does that look like in practice? What are some key things our listener can do to prioritize their breast health?
Well, the cornerstone of breast health is awareness. Get to know your breasts, their normal look, feel, and texture.
Yeah.
Regular breast self-exams are essential for detecting any changes early on.
If you notice anything unusual, don't hesitate to contact your doctor, right?
Absolutely. Early detection is key for any breast health concern.
Yeah.
In addition to self-exams, regular checkups with your doctor, including clinical breast exams and mammograms as recommended, are crucial. These screenings are like taking your breasts in for a regular tune-up, ensuring everything is functioning optimally.
Those routine screenings can truly be lifesavers.
And don't underestimate the impact of lifestyle choices on breast health.
Okay.
Maintaining a healthy weight, eating a balanced diet rich in fruits, vegetables, and whole grains, limiting alcohol consumption, and getting regular exercise.
Right.
These are all powerful ways to support your overall breast health.
It's a reminder that our daily habits play a significant role in shaping our long-term health and well-being.
Now, as we wrap up this deep dive, I want to leave you with one final thought.
Right.
While it's important to be aware of fibroadenomas and other breast health concerns, it's equally important to remember that our bodies are incredibly resilient.
That's such an important point. We often focus on what could go wrong.
Right.
But it's equally crucial to acknowledge our body's innate ability to heal and thrive.
Exactly.
Yeah.
So armed with knowledge, a proactive approach, and a healthy dose of self-care, you can confidently navigate the world of breast health and embrace a life filled with vitality and well-being.
Beautifully said. And on that note, we'll bring this episode of the Deep Dive to a close.
Okay.
We hope this exploration of fibroadenomas has been informative, empowering, and perhaps even a little bit inspiring. Remember, knowledge is power, and you are your own best advocate for your health.
Yeah.
Until next time, take care and keep those brains buzzing.
Yeah. It can be tough.
Yeah.
Even when you know intellectually that it's benign,
Right.
there's still that emotional component.
Exactly.
So it's important to validate those feelings and seek support.
That makes sense.
Yeah.
So besides talking it out, are there any other coping mechanisms that might help?
Well, mindfulness can be a powerful tool.
Yeah.
Practices like meditation or deep breathing can help calm those anxious thoughts.
Those are always good go-tos.
They really are. And for some people, journaling can be incredibly helpful.
I hadn't thought of that.
It allows you to process your emotions and track any patterns or triggers.
Yeah, that's a great idea. It's almost like turning those abstract feelings into something tangible you can work with.
Exactly. And remember, self-care isn't selfish. It's essential.
Making time for things you enjoy, whether it's reading a book, taking a bath,
Right.
or spending time with loved ones, those can all help to boost your mood and reduce stress.
And don't forget about the power of nature.
Oh, yeah.
Even a short walk in the park can have a profound impact on your mental and emotional well-being.
Nature is definitely the best medicine sometimes.
It really is.
So we've covered a lot of ground today.
We have.
And I think the key takeaway is that fibroadenomas are incredibly common.
Right.
And in most cases, they're nothing to worry about.
Exactly.
But as with any health concern, knowledge is power.
Absolutely.
Understanding what fibroadenomas are,
Mm-hmm.
how they're diagnosed, and the range of treatment options available
Right.
can help you feel more in control and make informed decisions about your care.
And it's important to remember that you're not alone. There are countless resources and support systems available,
Right.
whether it's your healthcare provider, online communities, or loved ones.
Well said. I think this deep dive has given our listeners a lot to think about,
I hope so.
and hopefully a sense of empowerment as well.
Absolutely.
So until next time, stay curious, stay informed,
Yeah.
and most importantly, take care of yourselves.
That's good.